Well, welcome everybody to another segment of Lewis at Large. Yours truly, Warner Lewis from the flight deck. And of course, that means some smart talk radio is in your future. And this segment should be an interesting one indeed. We're going to be talking to Dr. Mel Pohl. He is a board-certified family physician who specializes in treating chronic pain and co-occurring addiction. He is a medical director of the Las Vegas Recovery Center. A fascinating new work called The Pain Antidote, the proven program to help you stop suffering from chronic pain, avoiding those addictions to painkillers, and reclaiming your life. We're excited to have him here. Dr. Pohl, how are you, my friend?
I'm well, thanks. Thanks for having me.
Good. This whole world of curing pain, chronic pain, which leads to medication, which can lead to addiction. Am I wrong, or is it more and more common maybe than ever before?
Oh, I think that it is. There's a number of reasons why we, as an aging population, if you will, there's more of us who are over 50 than under 50, and the longer we walk on our feet and strain our backs and lift things and go skydiving and lift weights and fall down, we damage parts of our body, and the natural consequence of injury is potentially chronic pain. So, it's over 100 million Americans are estimated to be suffering in some form or other with a chronic painful condition. The way we treat chronic pain in our culture is rather unfortunate, because what we do is, if you go to the doctor, and it is the number one cause of going to a doctor these days is chronic pain. You walk into the doctor's office, you tell your story in an abbreviated version, maybe some tests are ordered, and what's the next thing that happens? It's take out the prescription pen and let's try something to help you. And if non-narcotics are not successful, the next sort of logical, but as it turns out, illogical step is to put somebody on an opioid, and we're off and running.
I'm sure you probably get conflicting evidence here, but from your work, Dr. Pohl, what do you see in terms of, are people requesting more and more just give me a pill, or are they saying, no, I want to go the other way. I want to do something more sort of natural, so to speak, and not quite as invasive as pills?
Well, I think at least theoretically people might say the latter, but I think in practice it's the former. The way physicians respond to conditions is we look at symptoms, try and make a diagnosis, and treat it, and the most readily available right in front of us is to get out a prescription pad and write a prescription. And I unfortunately think that in our culture, we are I don't want to feel kind of culture. So there's a pill for anxiety, and there's a pill for sleeplessness, and there's a pill for pain, and there's a pill for attention deficit, and there's a pill for I can't wake up, and there's a pill for I can't go to sleep. And I think it is all too often the tendency of the physician and the patient in this case to sort of be complicit. Let's not feel what we're feeling, and I think that's the root of the problem.
Do you find that, are there any correlations, socioeconomic, gender-based, age-based, any patterns to some of the painkiller addictions, and again, any other patterns in terms of where they fall on some kind of a social or gender scale?
There really aren't. Some interesting things when we look at the sociological aspects of this. For example, it's harder for African American people in a disadvantaged population to get access to these medications because of what's perceived as a mistrust of the patient, of the veracity of the patient's complaints. The real concern that I have is not only are people who are aging getting prescriptions for painkillers, but also it's young people. The number one group that is taking these painkillers and developing problems with addiction to the painkillers is 18 to 25-year-olds, and right behind that is 12 to 17-year-olds. Now, that is not always driven by a pain condition. It's often a desire to either get high or escape from sort of some of the stressors of life, which is, for an adolescent and an early young adult are very prominent.
What about, again, and this is a one that you must hear all the time, my body hurts, whether it's my knee, my joints, my back, who knows what.
Right.
What in the world? I'm terrified to even move or stand or look in the wrong direction because it hurts so much, so to speak. But that's really not really what you're going to be calling for. You want them to move, don't you?
That's right. Well, first I would say stop complaining. Not really. But one of the things we do intuitively is when it hurts, don't do it. You know, that's sort of an old joke from, I think, Henny Youngman. But the truth of the matter is, if we don't move because we're afraid it's going to hurt, we end up being unable to move, and we have restriction of movement, and we have scar tissue forming, and we have decreased circulation, and all of that increases the pain. So the worst treatment, for example, of a condition like fibromyalgia, which is a central pain syndrome where people have really pain all over their bodies, is to lie in bed, and the treatment of choice is getting up and exercising. And Kathy Ketchum and I, my co-author, talk a lot about that in this book, because it's not our way. It's not. If it hurts, stay away from the pain, and in fact, that is really part of what exacerbates the problem.
Well, I'm going to be, I rarely use this show for personal medical advice, but I do have a question for you. I'm a golfer, play a lot of golf. I've got pretty wicked cases, sort of golfer's elbow / tennis elbow. Had a shot of cortisone, which has helped quite a bit. For an example, though, even though it hurts, is it safe to play with?
It really, really depends. I mean, there's two sides of this coin. One is, if you immobilize those joints, they will get worse. However, if there's something intrinsically wrong in the joint and you overstress it and you injure it further, you may be making things worse. And, you really need a good medical assessment.
Right.
You need somebody to evaluate your function, a good exercise physiologist to guide you through activities. Because one of the things I see with the patients who come to treatment here in Las Vegas at the Recovery Center is that people are immobilized, and then they start to feel better. We take them off their drugs, and they want to get up and do what they did when they were 20 years younger. And that's a huge mistake, because you can really cause injuries if you overdo. So it's really, it's not our way, but it is a really finding a balance between hurt and harm, and it's a really fine edge, right. And it takes some skill and some practice and some consultation with somebody who understands these processes.
Again, if you just joined us, yours truly, Warner Lewis, from the flight deck of Lewis at Large Radio. In this segment, we're talking to Dr. Mel Pohl. He is a board-certified family physician specializing in treating not only chronic pain and occurring addiction. He's the medical director of the Las Vegas Recovery Center, along with Catherine Ketchum. Brand new work called The Pain Antidote. It's all about helping you stop suffering from chronic pain and avoiding addiction to painkillers and getting your life back together. What about, Doctor, what's sort of a classic case that comes into to your recovery center when they come into recovery centers all across the country? And again, we want to be careful here, not be alarmist, but if someone is taking painkillers or on any kind of a medication related to pain, and they feel like, if this almost feels like this has got more control of me than I've got control of it, what are some symptoms they can look for?
Well, certainly regular use of the medication is the first and foremost. And what typically happens is people say, I'm really in pain most of the time. I take the painkiller, powerful narcotic, and it takes the edge off the pain for a little while, and then the pain comes back in full force. So and the result of feeling that way is often escalation of the dose. So instead of staying at a steady dose, we see the dose get more and more. So, I'm taking either more doses of one particular medication or higher strength dosage, so hydrocodone to oxycodone to morphine to methadone, for example. That escalating sign means that the body has become tolerant. And typically, when we're tolerant, it's going to be really hard to back off on the dose because of physical dependence. And one of the things that I'm often told is, I can't stop these medicines because when I stop, I feel worse. Well, the reason a person feels worse when they stop is because they are physically dependent They may be addicted, but whether or not they are physically dependent, and the increase in pain is temporary and can be managed, and we do that here in Las Vegas in a detoxification program that begins the process. And we see people with spinal disease who've had multiple surgeries, and we see people with chronic headaches, or, as I mentioned, fibromyalgia. We have somebody in now who's got a severely broken foot and has had deterioration of the bones with a very unusual condition, and she has pain every time she walks on it.
What about, again, I'm curious as to your thoughts as to just the medical profession in general, and I know this is, you can't stereotype the entire country, but overall, do you believe the medical community, do we knee-jerk and prescribe painkillers too quickly when there may be other options there, and ultimately, because of this, we're seeing a rise in addiction?
Yeah, I definitely think that is the case. I think the vast majority of physicians and people like nurse practitioners and physician's assistants want to help. And as we said, the most readily available help is a prescription pad. But what we're not doing as medical practitioners is really following closely the progress of the patient. If the person gets a medication and their life gets better, because we really ought to be treating to improve function. If their life gets better and their dose is stable, that is a good trial of medication, and that can be continued as long as we keep a very close eye on the dosage and the improvement. What I see too often is that the prescription is written, the patient leaves, comes back in a month and says, "It's working, doc." They write another prescription and comes the next month, "It's not working, doc." And then is the problem where the doctor doubles the dose or gives them a stronger medication. And what's missed here is that people tend to do less. They feel more depressed. They don't engage in family activities. Maybe their performance at work goes down, or they're just falling asleep in their soup. And those changes indicate we have to get these people off opioids and really look at an alternative to trying to medicate away the pain. And I can tell you that happens about 70% of the time in people who are given prescriptions for long-term use of opioids.
What about, again, this whole move, a very, very, very major move to more healthy foods, more whole foods, so to speak, holistic medicine, et cetera? I'm sure you're embracing that at some level.
We are, both at Las Vegas Recovery Center and in the book. I mean, that's the third part of the structured interventions include significant areas around diet, both what to do and what not to do. So there are foods that are anti-inflammatory, like particular kinds of fruits, cranberries and walnuts and tart cherries. And there are particular foods and substances that make pain worse, and nicotine is a typical culprit, but also processed foods and artificial sweeteners and sugars. Processed sugars are really very bad for the system. Exercise is really key, so keeping moving and graded, structured exercise. And we spend a lot of time in the book talking about pain. The approach to pain really has to include our thoughts and our feelings. And there are many modalities that we describe in quite a bit of detail about how to work with what we call faulty thoughts. In other words, "my back is killing me" is a very, very destructive message that many people tell themselves on a regular basis. And of course, the back is not killing me. It's not going to be on your death certificate as the cause of death. But that powerful message really impairs people's function. So we spend a lot of time in the book talking about journaling and a technique called free writing, where you actually write and throw it away, so you're kind of dumping out some of these really crazy thoughts, really unhealthy, crazy thoughts. And then dealing with emotions is absolutely critical to be able to recover.
One of the subjects that you talk about in the book is that chronic pain, in essence, can in fact affect some, not necessarily of the function, but it does in fact affect the brain. Expand on that a little bit.
That's the most interesting part of this work. What's known now, and there's more than a handful of studies about this, is that if, let's say, I have a back pain condition, which I write about in the book because I love talking about it, and my back has a bulging disc with pressure on the sciatic nerve, and that nerve, it fires all day, every day, day after day. And as a result of chronic firing, what happens is the signal gets wound up in the spinal column, and it actually gets amplified because the system thinks it's necessary pain, when in fact my back pain is not necessary. It doesn't really keep me from doing anything. It's like an alarm clock went off. The alarm has told me there's something wrong, and it just keeps buzzing. And the buzzing is really coming not as much from my back as it is from my brain. The receiving part of the brain, it's an area called the midbrain, and there are a bunch of fancy medical terms, but basically there's a reverberating circuit that is set up inside the middle part of the brain, and that's the experience of chronic pain. And it's a hard sell for my patients. They say, "What are you talking about? It's my back that hurts. It's my foot that hurts." And I very patiently spend time explaining that over time your brain has changed, and now it is the brain that's making the pain signal, and more importantly, you can do something about that signal if you pay attention to your brain. If you're working only on the foot, we end up missing the boat. Amputating a foot isn't a solution for a condition that's really emanating from the brain.
Again, we're talking to Dr. Mel Pohl, the co-author of The Pain Antidote, newly released. It's a 4-week jumpstart plan, a proper program, a proven program, rather, to help you stop suffering from chronic pain, avoid addiction to painkillers, and reclaim your life. Dr. Pohl, I'm curious as to, in addition to just the life's work that you've done, as you did research and put this book together, what did you learn that really surprised you? What was a big headline that you found out on your own?
We came up with, the title is The Pain Antidote, and we tried to, I don't know that I learned it, but it was really an opportunity to consolidate my thinking. And the final chapter in the book really says that you have to know what's going on, be aware of it. You have to have diligence and courage to really, there's a lot of really powerful techniques that can be employed, but you have to do them. And we think that hope, faith, and compassion have to be part of this. And then the final issue is that life has to be better. It shouldn't be governed by the pain, and that's finding the joy and wonder in life. And that's what I see with my patients over the years that I've treated them, much to my surprise, because people come in drugged and depressed and disabled, and they wake up, and in waking up, they really have an opportunity to shine.
What about the med schools and the younger physicians that you see? Are they kind of tuned in, kind of where you are now, or are there still a lot of old school thinking and prescriptions and ways to treat pain that's still out there?
Yeah, I'm sorry to say that I am not optimistic about the future. Now, there are medical schools where this curriculum is taught and holistic measures are introduced, but the vast majority of physicians in early training and my colleagues who are out, in fact, I'm giving a lecture in Las Vegas to a group of physicians, and it's a tough group. They listen, they're polite, but I don't know if they really are convinced that the real issue here is the brain function, and until and unless we deal with people's thoughts and feelings about pain, we're not going to make them better. And I honestly don't think that's an intrinsic part of the curriculum, unfortunately.
What about, again, you can't talk about medicine anymore without talking about the Internet and the information that's available out there. Overall, when you look at it, especially for those that like to do some self-diagnosis and some of the other things, is it a net plus or net negative where you're sitting?
Well, that's a good question. Diagnosis often isn't a net plus, because what we find is people get a diagnosis and then they're attached to a particular treatment. I have a ruptured disc, I need surgery. And there's 60% of people that have ruptured discs on their MRIs don't need surgery. Surgery doesn't help them. In fact, 40% of them are not even symptomatic. So I think an educated consumer, that is the patient, is beneficial, because we really we're dealing with somebody who can make some sane choices. But unfortunately, there's such an overload of information that's available on the internet that people are often steered in directions that I think are less than helpful.
Well, as we start to wind down here, who is a candidate? Lots of people are candidates to read this book, but the Pain Antidote speaks specifically to those suffering from chronic pain and also may have some addiction issues as a result of that. Who needs to read this book? Who absolutely has got to get a hold of it?
Well, I think anybody who's suffering from chronic pain, whether they're taking medications chronically or not, can benefit from this book. We spend a lot of time explaining chronic pain in the first part of the book. We really go into a lot of depth about dependence on drugs and the disease of addiction, which some people develop. But really, the third part of the book is all about solutions. And once the drugs are either diminished or gone, it's about finding a way to, as I said, to exercise and to get nutritionally supported, and to try some techniques that may be helpful, like yoga and qigong and acupressure and acupuncture if you can access it. And the book is really meant as a primer for people who can, sort of take parts of it and really apply it in their lives.
Well, again, the work is called The Pain Antidote by Dr. Mel Pohl and Catherine Ketchum. Fascinating stories here and information, including a 4-week jumpstart plan that includes everything from diet, exercise, self-reflection, keeping a journal, diet, on and on and on. Lots of very specific information here. Dr. Pohl, specifically, where can people go to find out more information, not only about the work that you do in the book, but also just on the subjects in general?
Sure. Well, the website for my treatment center is LasVegasRecovery.com. The book website is thepainantidote.com. And certainly Amazon or any of the booksellers, the book will be available. It's called The Pain Antidote.
Well, we appreciate you spending time with us today, and best of luck in your work, and would love to have you back on again sometime.
Thanks. My pleasure. Thanks for having me.
You bet. We will be back with more right after this on Lewis at Large.